Well, every one of us, it seems, is touched in some way by cancer. We all seem to know someone who's fighting it. In some cases, that person is us. Tonight, our national checkup on cancer. Where do we stand in the battle that has raged for centuries? Dr. Danielle Martin is with Women's College Hospital in Toronto. Dr. Sunil Verma is an oncologist at the Sunnybrook Odette Cancer Centre. And Dr. Samir Sinha is a geriatrician at Mount Sinai. Their thoughts in a moment. But first, some hard numbers. In the time it takes for tonight's panel, 7 Canadians will find out they have cancer. Think about that. 7 will hear that dreaded news in the next 20 minutes. 7 of 524 who, on average, will get the same news on a typical day. 210 Canadians will lose their battle against the disease during the same 24-hour period. Cancer remains the country's #1 killer, 30% of all deaths. 2 out of 5 Canadians will develop cancer in their lifetimes. 1 out of 4 will die from it. Those numbers are staggering, and yet they never seem to change in any significant way. Billions have been raised and spent in the fight against cancer, but is anything really changing? Will there ever be a cure? Are we too focused on treatment and not enough on finding the answer? What can we do as individuals to power prevention? Lots of questions, time for some answers. All right, a lot of intriguing questions there. Let's try and deal with some of them. Treatment. Are we too focused on treatment, not enough on prevention? Danielle?
Well, sure. I mean, I think that's true as it is in cancer. It is like that across all of medicine. And of course, we need to focus more on prevention. Interestingly, we've gotten good enough at treatment that we now think about cancer as a chronic illness. And I think that that is something that has really shifted in our lifetimes.
Now, you've got to deal with cancer every day. Are you, do you feel that in agreement with Danielle there, too focused on treatment, not enough on prevention?
I think prevention goes across the board, not only from a general public to prevent the incidence of cancer, but also how can we prevent cancer from coming back? And some of the elements that we'll discuss about cancer and prevention applies not only preventing cancer from starting, but also preventing cancer from returning for our patients.
Samir, where are you on this?
No, absolutely. I think that when we think about so many causes of cancer can actually be prevented, just by making sure that people don't smoke. We still have so many people who smoke on a daily basis when we know that ultimately that can lead to cancer. And now issues with diabetes and other things, there are things that we can do to maintain a healthy lifestyle, like exercise and focusing on that can actually help us prevent these issues from forming in the first place.
Okay, I want to get to some of those preventative methods in a moment, but in a sense, do we have to kind of change the way we talk about fighting cancer?
I think we have to change the way healthcare is delivered, it's taught, it's discussed. I was thinking back on our medical school training and how we've been trained as physicians. And we've been trained as physicians really to treat. And I think majority of our training is really in the treatment, and only a small segment of our training is in prevention. So we have to start from the ground up, from our training, from our education, to say, how do we approach prevention so that we can be able to discuss it and really champion this with our patients and across the general public. So I think it has many different elements. It's not only the public and awareness at the public level, but also at the educational level and also the way the healthcare system is set up, which is really very treatment-focused and not prevention-focused.
Danielle, the way we talk about this?
Well, I mean, if you've even listened to the language that we use when we talk about cancer, very militaristic, right? So you read this in obituaries, they lost their courageous battle with cancer. And, I think that these kinds of analogies, I get that they can be effective, for fundraising purposes, but I'm not sure that it really advances the way that we think about cancer, particularly now that many people are living with cancer for decades in our culture. Sometimes the best thing isn't to fight it, but just to live with it and to manage it. And so I think that we need to become a little bit more nuanced in the language that we use and a little bit less combative, because that limits our imagination about how we can deal with this illness, this set of illnesses.
Let's talk a little bit about prevention in terms of what ordinary people can do in terms of prevention. Samir, you talked about exercise and I guess in diet. There are different things. What can we do diet-wise?
So I think, Peter, I think diet is very important, but I can't stress smoking enough. So smoking, even though the message is out there, everybody is aware of it, but smoking still contributes to 20% of cancer out there. And that includes lung cancer, includes head and neck cancer, bladder cancer, bowel cancer, and it's across the board. So if we just reduce smoking, that reduces the incidence of cancer by 20% across the board, 20%. So that's striking. Then comes diet. And I think diet, there's a few cancers which are very linked with diet. And that mostly bowel cancer, stomach cancer, and to a certain extent pancreatic cancer. And if you were to change our diet so that it's high in fiber, high in fruits and vegetables, low in processed meat, low in red meat, that itself will decrease the incidence of breast cancer by 30%, will decrease the incidence of colon cancer by 50%. Just that change in diet. So
you're not saying ban those foods.
No,
You're saying just reduce the intake.
Yeah. I think we live in a society sometimes of excess, but we have to learn to live within our own means and in moderation. So if we have a diet that is more moderated, when we're talking about red meat and processed meats, and if we have a diet that is rich in fruits and vegetables and fiber, that in itself will lead to a substantial decline in colorectal cancer and breast cancer, and of course other cancers as well. And it's really remarkable when you do geographic studies to see which countries have higher incidence of these cancers, and very much related to, at times, the consumption of red meat, especially when we take a look at colorectal cancer. So I think, there needs to be a discussion amongst the society, amongst the general public, as to how we achieve that goal. Of course, it's, we can discuss it, we can have a discussion on this topic, but how do we actually get to that level where we start seeing an improvement? And the thing about prevention is not something that we see happening right away. It's going to take years for us to see those results, and we just have to be patient.
Samir, on either diet or exercise?
Well, I think both of them are equally important. So again, like Sunil and Danielle, I would say absolutely don't smoke. Just don't start it. Don't do it. We're seeing exponential rates of increase in smoking, for example, in China right now. Now that there's more wealth, there's more smoking. But it's the issue of not only diet that can lead to obesity and the other factors there, but just regular exercise. So even just going for a walk 3 days a week for 30 minutes, even that level of exercise. People often think of exercise as going to the gym, lifting weights, doing those things, but just staying physically active, taking the stairs as opposed to the elevator. Because I think, again, picking up on what Sunil said, is that I think a lot of us think about the treatment as the easy thing. I've got this, I'll take the pill, I'll be done, right? But the key with prevention is that sometimes I'll exercise, today, I won't smoke, I'll eat well, but I may not see the payoff. I may never see the payoff. But the key is, I think we know through enough research now, there is a significant payoff there.
Danielle?
I guess I would just say that I think while it's critically important for each of us to do what we can to improve our own health, I think we equally have to be careful not to lay blame at the feet of people who get sick. And sometimes I worry that the sort of individual agency argument can go too far. So, we know, for example...
Like what? What do you mean?
Well, you're much more likely to smoke and much more likely to be sedentary if you're poor in Canada. The social determinants of health are critically important, and you're much more likely to get sick of any number with any number of illnesses if you're living in poverty. So, I think we need to be careful about and I don't think that that's happening in this panel, but just in general, judgment about people. Sometimes it's easier. For example, we know people who have mental illness, very high rates of smoking with people who are living with serious mental illness. Well, there's more at play there than just individual choice. So I think giving people the information that they need and helping them to build their capacity to make those right, good choices for themselves is important. But if you smoke and you get lung cancer, I think we have to be careful not to be judgmental about that.
All right, I hear you on that, and I'm sure the other doctors do as well, but I'm kind of surprised that there's been so much focus on this panel on smoking, because I thought in some ways we were past the post on that.
Yeah, well, as Danielle mentioned, and I think I couldn't agree with you more, because there's this stigma when we have patients with lung cancer where, there's this stigma, I smoked, I deserved it. And the first discussion that we have, nobody deserves to get cancer, nobody deserves to die of cancer. And we are there to support you as much as we can, and we cannot have that blame game. you know, there's many people who smoke who never get cancer. And there's many people who have very difficult or different diets who never get cancer. So yes, I think it's important as a global view on this topic to help reduce the incidence, but individually, there's many other factors that come into play as well.
All right. You're still not telling me why we're still in such a struggle on
young girls
smoking,
are smoking. Young girls are taking up smoking in Canada still. And so, you know, and it turns out actually that the big ways to reduce, the big inroads that we've made in Canada on reducing smoking haven't been at the level of individual choice. They've been public policy decisions. Taxes on cigarettes, banning smoking in public places. Like, these are the things that have taken us from the levels that we were at to the levels that we're at now. But what's the incidence of smoking in Canada now? Like 20% or something, right? So, you know, that's still a considerable number of people who are struggling with this, and it's not because they think that it's good for them. You know, these are complex factors at play.
And I think that the challenge is here that I think we're so focused on it because it's the most obvious thing that we can do. Just like, you know, as we said before, diet and exercise are important elements, but sometimes people can't see the payoff. We know there's an instant payoff if you don't smoke, not just for cancer, but for a variety of reasons.
Okay, I've only got a minute left before I got to take a break. But in that minute, in terms of treatment, are there new things that are happening? I mean, traditionally it's a kind of chemo, radiation.
Right.
What about something else? Is there something else?
It's tremendous right now. So I think the whole area of targeted therapy, for us to be able to tailor a treatment based on the specific type of cancer a patient has, is really where we are here today and we're headed in the future. So, for example, lung cancer. So lung cancer, you know, when I was finishing my training in the late 90s, we had chemotherapy. We had a patient who had advanced lung cancer, came to us. We had one line of chemotherapy. We said, that's it. There's nothing more to offer you after that. Now we see a patient with lung cancer. The first step we do is analyze what is the tissue makeup and what is the cancer makeup. And is there a biomarker that can help guide us what is their treatment? In 1998, in our own institution, the likelihood of surviving lung cancer 2 years was less than 1% if you have advanced stage cancer. Now it's above 20, 30%. And patients are living longer, they're living better because there's more personalized treatment. So that has just happened in the past decade. And moving forward, I think we'll have increased adoption and integration of these targeted drugs.
All right. I guess the question, and we'll come to it after the break, is they're living longer, but they're still going to die from it. And that becomes the question, is there, you know, is it an impossible dream, that question of a cure? We'll get to that right after this quick break. And welcome back to the National Update tonight on cancer. At the table, Doctors Danielle Martin, Sunil Verma, and Samir Sinha. Danielle, start us off. Is it an impossible dream to think of a cure for cancer?
Well, there won't be one cure because cancer isn't one disease. And so in that sense, I suppose, yes, it is an impossible dream. But that's not to say that we won't make huge advances on any number of different cancers. Again, I think that what's really interesting is the emergence of cancer as a chronic illness. I mean, do we need to cure it if people can live long and productive lives with their cancer because we've developed effective treatments? And what are the implications around the kind of healthcare we're going to need for people if that will be the case?
Sunil.
I completely agree. I think it's going to be a concept of living with cancer for those patients who have advanced cancer. For those patients who have early stage disease, we've already cured, you know, majority of our patients with breast cancer, 85% of them are cured. When we looked at colon cancer, more than 70% of those patients are cured. So early stage, yes, the cure is possible. Advanced stage is how do we make sure that patients live a full, complete life with cancer like they can do with diabetes or high blood pressure.
Samir.
And I think many people think that if they're diagnosed with cancer, well, this is what's going to kill me. But for many of my patients, you know, who are in their late 80s, their late 90s, many of them are living with cancer. Many of them will actually die of things other than cancer. So I think it's also helping people in those decisions, making sure that, you know, you may not actually need this treatment because you're probably going to outlive that cancer. And we should focus on other things that improve your quality of life.
Well, speaking of focusing, what about current research? Where is it focused? And quickly, once around the table on that.
So I think there's many different areas of looking at personalized medicine. Our understanding of the genome has really opened up a whole area of research on how we can target and personalize our treatment based on the genetic fingerprint of the cancer. But one specific area that I think the viewers would be very interested to learn more about is immuno-oncology. So this area that we can actually use our own immune system to target cancer cells. Cancer cells are very good at masking themselves and basically taking away that mask so the immune system is able to recognize these cancer cells and able to target them is a huge area of interest and research moving forward.
Samir?
The other area, when we think about personalized cancer medicine from it as a geriatrician, is the field of geriatric oncology. So we're actually saying that sometimes people are being undertreated because they're just too old. Other times they're being overtreated because it may not be the appropriate treatment for them. So it's about looking at our patients, whether they're young or whether they're old, and actually making sure that we understand their entire health picture, their entire social situation, and tailoring their treatment that way as well.
You got the last word, Danielle.
Well, as we start to understand increasingly the genetic and in some cases infectious causes of cancer, I think we're going to see more in the way of vaccines, so actual cancer prevention, where we can identify an infectious cause, the HPV vaccine against cervical cancer and other cancers being a prime example of that. I think we will see more of that in the future as we come to understand the way that infectious diseases can play a role in the development of cancer.
Great discussion. Thank you all. And thank you as well. Tonight, prevention and treatment was our focus, but this is just the beginning of our Checkup conversation on cancer. We want to hear from you, from screening to medication costs and care. Send us your questions for our next Checkup panel.